It's U of L Today on 93.9 The Ville. Here's your host, Mark Hebert.
Welcome to U of L Today with Mark Hebert on 93.9 The Ville. Hope you're going to join us for the next 30 minutes or so, where we talk about all things University of Louisville. We'll be talking about some research and some cool stuff going on campus. So, on the show today, why do we bury people in cemeteries? How does a cemetery link nature, culture, and history? We'll talk to a U of L professor who's done extensive research on Cave Hill Cemetery right here in Louisville and what it says about us as Louisvillians and humans and our history here in Louisville. Also, advertisers know exactly how to hook your kids into begging you to buy a certain toy. You'll hear why Disney is such a profitable brand from a U of L psychology professor. But first, e-cigarettes, vaping, hookah. There's a great debate on how much people should be worried about the health impact of these forms of smoking. Is it a healthier replacement for smoking tobacco? Kandi Walker and Joy Hart are communication professors at U of L who have been doing research on public attitudes surrounding these types of smoking, while Aruni Bhatnagar is the director of the Diabetes and Obesity Center at U of L, and he's an environmental health scientist, and they're here to talk about this issue. Welcome all.
Thank you.
for having us.
You've all been on the program before. You know what we're doing here, right?
Sure.
All right. Well, let's talk about this. Start with the vaping study. Joy and Kandi, you guys looked at folks who work in vape shops. So why don't you talk about what a vape shop is and what the study was all about?
So as e-cigarettes grew in popularity, a new form of retail outlet emerged, the vape shop, which specializes in customizable electronic cigarettes. So we're a few generations into these products. And we became interested in looking at vape shop customers, but also looking at people who worked in vape shops in terms of their perceptions.
All right. What'd you find, Kandi?
So if we start looking at the perspective of an employee, looking at please come in, buy something from my shop, it could just look like any other sales pitch. But really what we found was they believed that they were helping their customers. Customers would come in and say, I need help reducing my cigarette smoking. And so they believed that they were helping customers reduce their cigarette habit.
Okay. So adults, obviously, right?
Obviously adults.
All right. So, Aruni, from a health perspective, is that a good thing or a bad thing? Are they doing good for their customers? Is vaping and e-cigarettes, are they better than tobacco cigarettes?
Well, that's the big debate.
Yeah, I know it's a big debate. That's why I put you on the spot.
That's right. It's not clear. There are some people who fervently believe that they're doing a great thing, that they are helping their customers, and that they are weaning them off from this dangerous combustible tobacco death sticks into this really pleasant, and aromatic e-cigarettes that everybody thinks are rather innocuous. But the point is that we don't know whether they are really innocuous, whether they are less harmful than cigarettes. Nobody has looked at people who have used this for many, many years. And people say, oh, I smoke, I vape and I feel better, there's nothing happening to me. Well, you can smoke a cigarette and do that for the next 20 years, nothing would happen to you. But sooner or later, it'll catch up. So that's the major debate now, that in the long term, are there adverse health effects that would appear when we have a generation of people using these things? Certainly, it has some constituents. It has nicotine, it has particles and some toxic chemicals that might have these long-term effects, and that's what we try to study.
We're talking with Aruni Bhatnagar, Joy Hart, and Kandi Walker from the University of Louisville. We're talking about their studies on vaping and e-cigarettes, those kinds of things. What'd you find in terms of youth? And you guys did a specific study on youth attitudes towards e-cigarettes and vaping. What are the attitudes of Kentucky's youth on these things, or just in youth in general?
So part of our study was looking at Appalachia children and youth, so middle school and high school perceptions and attitudes. We were in 3 different states. We were in North Carolina, New York, and Kentucky based on just tobacco rates in general. So if we look at just our Kentucky youth that we studied, they were very curious about e-cigarettes, and we saw that they were using and experimenting with e-cigarettes and different types of e-cigarette products, and they were interested in the flavors. So flavors became an issue of, is this intriguing them, so they just want to try it? And there's a lot of misunderstanding or just ignorance, and not ignorance in a bad way, but they just don't know, but they're eager to know. Is this good for me? Is this bad for me? I don't know. I've been told it's water vapor, but it doesn't seem like it would be. So there's just a lot of confusion that the middle school and high schoolers were just looking to say, this is what I believe, but I'm hesitant also to believe what I believe.
All right.
And to put that in a broader context, as combustible cigarette use has declined in youth, e-cigarette use has increased. And e-cigarettes are now the most frequent product that middle and high school students are using. And as Aruni pointed out, the health effects are not yet known. So there's some level of concern because it's a product that we don't know what the results will be when they're 40 or 60.
Right. And Joy, I talked to Jason Chesney, who's the head of the James Grant Brown Cancer Center, for another program, and he said that there's a significant worry that that's a gateway, that e-cigarettes are a gateway to real cigarettes. Tobacco cigarettes, obviously, which have terrible health effects for kids. Did you find kids are worried about that through your survey?
And there are a couple of recent publications out. One in the U.S., a meta-analysis that looks across multiple studies that shows that youth who use e-cigarettes do transition to combustible cigarette use. And there's also a recent study published in Europe where attitudes toward e-cigarettes have tended to be more positive that suggests the same thing. Again, that's some evidence. I don't know that we have conclusive proof yet that there's a gateway, but it is putting red flags in some people's minds.
Why are they important for public health reasons? You're a public health guy. Why is this important that we do studies like this?
So here, our work here in UofL is part of the American Heart Association Tobacco Center, and we work with the FDA in trying to develop a scientific base to be able to regulate tobacco products. And so it's critically important to the FDA, not only that we know whether the e-cigarettes have health effects that are different from combustible cigarettes, but also who's using them, why they're using, how they're being sold. So there is the health message that you can tell people, oh, this is bad, and so on, and that only goes so far. We have to try other approaches. For example, increase the age at which e-cigarettes are available, where they are placed in stores. In some stores, we found that they place it at level of the children's eye level. So that's not acceptable, and then they should be behind the counter. Then we should know what sort of populations are using, why they're using it. So all of these factors go into regulating the distribution, the marketing, and the manufacturing of e-cigarettes that the FDA needs to do in the coming years.
And Kandi and Joy, I know you looked at vape shops specifically, but have you looked at hookah bars and those kinds of things yet?
We've only pitched around and done a little bit of work there, but nothing that's detailed enough to share today. Maybe that's a future program.
That's one down the road. As soon as you get a grant to study it, right?
We did do a recent project with university students who are well-educated folks across the population, and one of the interesting things there is we looked at something called a GRAS rating, so a product being generally recognized as safe. And because we heard a lot of conversations about this in vape shops and in other conversations in the community with people about electronic cigarettes. So the GRAS rating is for ingestion, so food additives, for example. But many people believe that that carries over to the contents that are inhaled when using electronic cigarettes. So we asked college students what this designation meant, and the majority of them thought that that meant products beyond ingestion were also safe to inhale, especially if they used electronic cigarettes already. And so that's a factor in terms of getting information out to people from a public health standpoint.
And so are they safe? Are the ones that are marked as GRAS, are they safe?
They're safe for ingestion.
That's what's been researched. But are they safe to smoke?
That's the debate. That's where we are in the conversation. So if we think about the conversation, we are just at the very base of it. And if people think, oh, this is safe because it has this generally recognized as safe logo on it, it was tested for the ingestion. It wasn't tested to inhale it or put it on your skin or any other way. So really, it's again another way that people are being misled.
Right.
So it might be that the question is even more complex than that too. It might not be, is it safe or not safe, or safer or less safe? It might be that it's safer in some ways potentially, but more harmful in other ways. And so there's a lot that needs to be teased out of that whole mix.
All right. So Aruni, what's the message to parents out of all of this study?
So the key message is that whether it's combustible cigarettes or whether tobacco cigarettes or whether it's e-cigarettes, they are all forms of addiction, and nicotine is a very potent addictive drug. And if you start off with one device, it's very easy to switch to another. It has very profound effects on the developing brain, particularly the adolescent brain, and it rewires your thinking altogether in a different way. So we should do all we can to minimize the impact of addiction in a society, particularly in young developing adults. It could put them on a different route of lifelong addiction from one substance to another, which cannot be a good thing.
All right. Joy, Kandi, Aruni, it always goes by fast, doesn't it? Didn't that blow by fast?
It
All right.
flies. Thank you.
All right, but I know you got some more studying to do on this, right? You guys are pursuing this area, so we'll have you back on the show and talk about the next study. How about that? Stephen Schneider is an English professor at UofL who has a fascination with Cave Hill Cemetery, including who's buried there, the memorials, the landscaping, and the history, as well as what it says about us as Louisvillians. And he's doing a presentation on all of this Thursday, September 7th at noon at the University Club, and he's here to give us a little preview. So welcome, Stephen.
Great, thanks, Mark.
So you're an English professor.
Yeah.
And you've been at UofL for how long?
I'm going into my 8th year, so I joined in 2010.
Okay, so English professor who's interested in Cave Hill Cemetery. So
Yeah.
how'd that all? Well, I guess first we ought to ask you, where are you from? Since
Originally Australia. So I came over here to do graduate school and I never quite found my way home.
got married.
So
right?
got married, had a kid and joined the UofL faculty. So
There you go. Well, glad to have you. All right. Well, back to my question then. How does an English professor get excited about Cave Hill Cemetery?
I've always been kind of interested in how cultural institutions and the kind of environment around us helps construct our notions of ourselves, helps tell us kind of where we are, but also like who we are as part of that. So Cave Hill Cemetery is really interesting because it's not just a place where the departed go, but also a cultural institution and in some ways a museum of municipal history. So I was interested in looking at how did that come to be, and what can we find out by walking around the grounds.
So you probably had no idea in Australia anything about Cave Hill Cemetery. You moved to Louisville. You hear about this iconic cemetery really in Louisville. So how'd you get that interest?
Well, my daughter went to preschool right next door at Eastern Star, and so they would go for walks through the grounds, and eventually we took her there for a walk, and in passing someone told me that the poet John Keats' brother is actually buried in Cave Hill, and so then I started looking up, well, who else is buried there? It turns out T.S. Eliot's brother is also buried there in his wife's
So the brothers
family
of really
lot.
famous people are buried there, huh?
Yeah, so that's kind of the... and then really looking at most of the people that streets are named after are also buried there, and I kind of just got interested in the municipal history aspect of it from there.
So it really is almost a dead history, for lack of a better term, of Louisville, the city of Louisville, and that's what kind of sparked your interest, I suppose.
Yeah, and the more that I kind of looked into it, the more it was really obvious that in 1848, when Cave Hill was chartered, that they already had an idea that this is what they wanted the cemetery to be, that they wanted to be a cultural institution that, in their words, would be a place of kind of moral education, but also a way of kind of preserving the city's history for kind of subsequent generations and making sure that people had access to that at a time when Louisville's expanding rapidly and people are really worried about commerce and change and what does all this progress mean. So this was kind of a stable way to represent that. Also prior to public parks and other things being available.
Right.
So.
Well, it's almost a public park. It just has gravestones in it, right? And
Yeah.
monuments, right?
Yep, and the Olmsted brothers helped lay out certain sections of Cave Hill.
I did not know that.
yeah,
Frederick
around
Law Olmsted helped lay out Cave Hill Cemetery?
Well, the Olmsted brothers firm did. So I'm not exactly sure on which dates, and it looks like it's later sections. So the section's closer to Lexington Avenue than to Baxter Avenue, but the Olmsted brothers did do some of the kind of later layout work.
Wow, I had no idea. All right. We're talking to Stephen Schneider. He's an English professor at the University of Louisville. He's taking a look at Cave Hill Cemetery. What did you find? I mean, what did you, out of this study of Cave Hill Cemetery, you went in and what did you look at? You just go up to the gravestones and say, oh, that's interesting, that guy's buried here, or that's interesting, that guy's buried here. What'd
Initially,
you do?
and then some things kind of stood out. The amount of reinterment that happened in the 19th century, where someone would be buried in one cemetery but then moved to another. Particularly, George Keats died in 1841, and so he's moved in the 1870s. One of the reverends that actually gave the dedicatory prayer when Cave Hill was chartered was originally buried elsewhere and then moved in 1890. And so I was that was kind of initially, I'm like, well, why would people move this, move bodies? But and some of it was just about availability of family lots. So subsequent kind of generations would say, well, I want all my ancestors buried with me.
Right.
But it also seems that some of it was recognition that certain people are just significant. George Rogers Clark, he was initially buried at Locust Grove and then moved to Cave Hill. And it's probably good that Cave Hill was around because initially he was going to be moved to the Frankfurt Cemetery, and they appropriated money to do that. But he ends up at Cave Hill and kind of remain a part of Louisville's history rather than being a kind of more general part of Kentucky history as well.
Right. I didn't know about George Rogers Clark. Who are some of the other figures? I mean, people know that Muhammad Ali is buried there now, obviously, because it's a recent burial. But who else is buried there that are significant figures in Louisville history?
So along with George Rogers Clark, there's also Meriwether Clark, who founded Churchill Downs. The Nicola Marshall, who's an artist that actually designed the first state flag for the Confederacy there, so which is probably somewhat controversial at this point in time. But the Hill Sisters that wrote "Happy Birthday,"
we're familiar with them.
Are there, and then there's a set of kind of interesting figures that are maybe lesser known, but Bland Ballard, who was a 19th century judge in Louisville, who actually presided over the first public transport desegregation case in the U.S., which is in the 1870s. Louisville desegregated city streetcars. And so he was a judge that presided.
I read something, I guess it was last week, that 50% of people who die now are choosing cremation over getting buried. So from your perspective, what do we lose or perhaps gain by people not being buried in cemeteries like Cave Hill?
So I think people get cremated for a whole range of reasons. Some are environmental. That, I don't want to be embalmed. I don't want all of that in the earth, and I don't want people to have to worry about the cost, and I don't want people to grieve. But I think it's maybe that last point is where we lose something that, as opposed to say traditional burial practices that would involve letting the body lie in state and allowing people to visit, and really showing a kind of care for the body and also a kind of care for the individuals that go into the ground. I think sometimes cremation is a way to kind of pretend that death doesn't happen. And I think some of the anxieties that we see about death and fears of death are perhaps attenuated by the fact that that we do have a kind of increasing number of cremations. One of the interesting things I learned too is that sometimes cremation is kind of handled from a records level, often by the funeral home, rather than a cemetery.
That's right.
And funeral homes are businesses like any other. They can cease to be if the money isn't there. Cave Hill is perpetually tenured. They have a financial mechanism for making sure that even once they're full, maintenance is going to continue until.
Right. So they got the money around to take care of that.
Yeah.
All right. Well, we got about 15 seconds left. So what would you tell folks about Cave Hill Cemetery? Go visit?
Definitely go visit. Walk around. Make sure read the markers and get lost in the place and kind of see what's there. There's kind of a lot of small jewels that really kind of stand out when you kind of stumble across them. So.
All right. Stephen Schneider, English professor at UofL. Appreciate you being on the show. Thanks so much.
Thanks a lot.
What advertising works on young children? What do marketing companies know about using cartoon characters in ads, and which characters are effective in selling to children? Well, Judith Danovitch is a psychology professor at the University of Louisville and has done some research on this topic and what interests little kids. Judith, welcome back. Good to see you.
Thank you for having me.
So we talked about this topic last time you were on the show, and I think you've done a little more research on it. So this just kind of fascinates me about what little kids will gravitate to. So why don't you talk about the research that you've done, and then we'll get into it a little bit more.
Okay. Well, what I've done is a series of studies with my collaborator, Dr. Candace Mills at the University of Texas at Dallas. And what we've been interested in is how does seeing a character on an object affect young children's judgments about that object, and specifically whether they want to have that thing. So we first started out by looking at older kids. For us, older kids is 4 and 5 year olds.
Not very old, but older
not
for
really
you.
that
Okay.
old. And what we did in our first studies is we showed them photos, and then later we actually showed them real live objects. And we gave them a choice between two objects. So one object, both objects started out identical.
So these are kids 2 and 3 years old in that area?
Well,
mainly?
3, 4.
3 and 4 years old.
3
I'm
and
sorry.
4, and then more recently we've looked
Okay.
at younger kids too.
Gotcha.
So what we did is we showed them two objects and said, which one of these would you like to take home? One object, I've brought some examples here,
Right.
was just brand new,
old
perfectly
plastic
normal toy or school supplies is what
Right.
we used.
It's like a little plastic cup that a kid
Yeah,
would
it's a little
play
bucket. right?
with. Yeah.
And then the other one was the same object that my research assistants, I have a lot of undergraduates who work in my lab, got to break, burn, throw in the mud and things like that. But on that object, so it's broken, and the key thing is that you can't use it. So you
Right,
can
it's unusable.
take anything in this bucket.
It's a little
right?
bucket with a broken
It's
handle.
got a big
and
gash in it,
yeah.
and the handle is broken in half. But we put a picture of the child's favorite character, and we had a few different characters they could choose from and tell us which one was their favorite on the broken, damaged object. And then we just said to the kids, okay, which one of these would you like to have? Which one would you like to take home with you today? And we were honestly very shocked to see how often, the majority of the time, 4 and 5 year olds, and now more recently we found this with 3 year olds as well, will choose to have a broken toy that has a picture of their favorite character on it over a brand new, perfectly good toy that they could actually play with. And the interesting thing is, of course, if we did try doing this without the pictures on it. So in that case, 99% of the time, the kids choose the new one. So it's not that the kids don't know. They
Right.
can
They
look at it.
understand you got a new one and a broken
Yeah,
one.
oh yeah, and some of the kids will look at it and say, that one's broken, right?
Right.
And then they'll still choose it. They'll still say, but I want that one because it's got Dora or Bob the Builder or whatever their favorite character is on it. So to us, this was really quite shocking. It was a surprising finding. And so more recently, we followed up with even younger kids, with 3 year olds. And we tried giving them a few different varieties of this task. So instead of their favorite character, we tried a character they had never seen before. We also tried just a star in their favorite color. So they say they like red, and it's got a red star. We also tried having pictures where the character was near the object but not actually on the object. And in all of those cases, the effect is not as powerful. So some kids will say they want the one with the star or with the new character, but not at the rate that they pick the one with their favorite character. So this just goes to show how powerful those images really are. Even on 3-year-olds, they can really have a huge effect on their choices.
We're talking with Judith Danovitch, who's a psychology professor at UofL. We're talking about a study she's done on small children and what they choose in terms of toys and what has to be on those toys for them to choose it. And so what does that tell you? You said you were shocked. But what does that tell you about advertisers, marketing, those kinds of things?
Well, marketers know what they're doing, right? This is a multi-billion-dollar industry, these brand licensed products, right, where you see Disney characters or other popular characters, on T-shirts, on school supplies, on food items. And so this just goes to show it works. And 3-year-olds, you can imagine, really haven't seen necessarily that many movies or that many TV shows, and yet they recognize these characters, and just seeing that character's picture makes that object have much more value to them. I think this is something, of course, parents need to be aware of, which is if you're looking to buy your kid a toy and they want the one with Dora on it, they really want that. That really has value to them, even if it's maybe not as nice of a toy as, some plain toy. I think parents could actually use this to their advantage. So, for example, say that your child is very reluctant to wear a bike helmet. Buying that helmet with Mickey Mouse on it could actually make a big difference in how much the child likes that bike helmet and is willing to wear it. So, I'd like to think that we can leverage this for a positive
Give parents
use.
a little advantage over that 3-year-old, right?
Right. If you really want to convince your 3-year-old to like something, get the one with their favorite character that they love on it.
What was the percentage of the 4 and 5-year-olds that picked the broken one with their favorite character versus the toy that didn't have anything on it? What was the percentage?
So we actually showed them 10 different objects. So the way we do these studies, right, we don't just ask them one time. We want to get multiple rounds. So 10 objects, and there were 20 kids, let's say, and it was roughly about 70% of the time that they would choose it. And it wasn't just particular objects, it was all over. Some kids would choose the objects 10 out of 10 times. They would choose the broken thing. There were a few kids who didn't fall for it, right? There were a few kids who did choose the new objects consistently, but that was very, very rare. Most kids, at least a couple of times, would say they wanted the broken thing.
Was there anything different about those kids that picked the new toy? Were they left-handed? Were they,
Right.
I don't know, did their parents say, well, they really have this trait?
That's a great question. Unfortunately, I don't have that data. I don't know what was it about those couple of kids. I would suspect that maybe, they didn't love the characters that much. We had a limited range of characters because we couldn't make objects for every single character that's out there. So it's possible that maybe they didn't really love that character as much as some of the other kids did. We did actually also do some research on their trust in statements. So this ties into more to advertising. Like when you see a commercial and you've got Dora saying, "Eat this cereal, it's delicious," right? How much do kids believe in that? And actually we didn't find any links. So there wasn't any connection between whether kids trusted the commercial type statements and whether they chose the broken thing. So many kids who didn't necessarily trust what the character said, they still wanted the toy with the character's picture on it. The toys seem to have a more powerful effect in terms of influencing their choices.
So the verbal sales job from Dora the Explorer or Mickey Mouse on TV saying, buy this cereal, hey kids, this cereal's great, that didn't impact them. But if you had Dora the Explorer or Mickey Mouse on an object,
so we didn't show them any real commercials. We gave them some more unusual statements to see would the kids believe those or not coming, and we manipulated things like whether Dora had been saying things that were accurate or inaccurate. So it was a little bit more complicated in that study.
So it wasn't quite that simple.
But the point was that their trust in the characters didn't relate to their choices. So even if they didn't really trust the characters, they would often choose the damaged objects.
So now we know why Disney's so powerful.
Yes.
Right?
Well, and if you consider that even by age 3, that's not a long time to, this of course works on adults too, right? Adults buy all kinds of brand licensed products with their favorite movie stars or their favorite athletes, pictures or endorsements or logos on them. But what's impressive is that by age 3, you can already form such a strong positive association.
Yeah. Well, I guess I'm not going to buy the torn jersey with Lamar Jackson on it as opposed to the brand new jersey of some player that I don't have as much affinity for.
Right.
So as an adult, you figure that out. I want the new one.
Right. Well, you weigh those things, but would you get it if it had maybe just a small little spot on it?
Maybe. If it's just a small tear in the back or something, I might buy that Lamar Jackson jersey, yeah.
So exactly. So adults would kind of weigh this, and one of the things this study shows is that for kids, the damage doesn't mean much, right? Even when they know you can't even play with that toy, right? We had a car where all the wheels were taken off. So you can't roll it around,
crazy.
but the kids still chose it.
All right, so the message to parents out of all this is what? What's the final message to parents out of this?
Beware is what I would say. So beware that, your kids are going to want the stuff with their favorite characters on it, even if it's not very good quality, and you're going to have a hard time convincing them not to get that, not so good bicycle with Mickey Mouse on it, if they love that character. But you could use it to your advantage if you want to convince them
to do something
use
they
some
don't want
product,
to do.
to use their helmet or use a toothbrush. Get that one with that character that they love, and they're going to like that object much better.
That's crazy. Kid psychology, right?
Yes.
All right, there you go. All right, Judith Danovitch, thank you very much for being on the program again.
Thank
Good to
you.
see you. Thanks for listening to UofL Today with Mark Hebert, and go Cards.